Hello, everyone. My name is Dr. Dennis Doster, Black History Program Manager at the M-NCPPC, Department of Parks and Recreation, Prince George's County. Thank you for joining us for this very important panel discussion on Black Health Matters. This is part of our series of virtual offerings that will be a part of our annual Black History Month exhibition of the same title, Black Health Matters, which will include a series of interviews, profiles, and many documentaries that touch upon this subject. So we are kicking it off today with this panel discussion on this very crucial and important topic. Our panelists today include Dr. Charlette Pace, who is pediatric cardiovascular surgery nurse practitioner with the Children's National Health System, Miss Victoria Torrey Tucker, who is a palliative care nurse with Virginia Commonwealth University, as well as a doctoral candidate in the School of Nursing at the University of Virginia. And then we also have Dr. Malcolm Woodland, who is Deputy Director of the Court Social Services Division of the Superior Court of the District of Columbia, as well as Acting Chief Psychologist with the Child Guidance Clinic of the District of Columbia, as well as co-founder and director of Young Doctors DC. So join me in welcoming the panelists here today as we get started with this discussion. Thank you all for joining us as we have this very important discussion about Black healthcare. And I'm glad to have with me Dr. Charlette Pace, Ms. Torrey Tucker, and Dr. Malcolm Woodland for this very important discussion during these very critical times in our nation. And so we're going to jump right into our discussion today. And at first, I wanted to start with asking each one of you if you could describe what you do within the field of healthcare and what led you to pursue that career in healthcare. And so maybe if I could ask Charlette to start, and then we can move on from there.
Great question. So I currently work as a nurse practitioner. My primary job is to prepare families of that have congenital heart disease for their surgeries, and I see them after surgery as well. My journey to become a nurse is really basically after my grandmother, because she was a nurse, she was an LPN, and we used to go with her to the hospital when we were younger. And I saw how autonomous she was. I always kept that in my mind. And I was very, very intrigued with what she did as a living. So as I kind of matriculated through school, I got off track and decided I wanted to, be an accountant, and then wasn't fulfilled. And so I decided to take another look back, like what was I excited about? And so I remembered how happy I was watching my grandmother and going to the nursing home with her. And that is how I pursued this career in nursing.
So I guess, Torrey, if you could pick up on that same question.
I love your introduction and how you also had sort of a zigzag to get to where you are now. Similarly, I didn't have any direct nurses in my family, if you were to consider the credential. But as I think back, I'm like, the women in my family did a lot of nursing-like work or caregiving roles, or just the way they showed up. And so I certainly was always inspired by how they showed up. I went to college initially thinking I wanted to study foreign affairs and economics, and I thought it was very interesting. I arrived in 2008. I will never forget when became First Lady Michelle Obama, but then she was visiting and promoting her husband, who became President Barack Obama, as president. And during that time, I just had this dream and this vision of taking my foreign affairs and economics work and applying it more broadly, maybe even traveling outside of the United States. And so I took those courses, and serendipitously, one of my classes ended up being within the School of Nursing, not because it was a nursing course, but because they had the space for all of the students. And I often sat in the School of Nursing before class, even after class, just taking notes and studying. And there was something very captivating happening in that space. The faculty there were very involved with the students, and I heard the students taking what they learned in the classroom literally in real time and applying it in clinical practice as they went to clinicals at the hospital. And I said, wow, there is something to this nursing school. And I really started to become more interested in nursing. I applied to transfer into the School of Nursing, and I did not get in. And honestly, at that point thought, well, maybe nursing's not for me. And my mom reminded me, she said, you know, since when do we quit at the first no or shut door? Sometimes you need those, we need to talk conversations. And it was the call home. And when she reminded me of that, I had the opportunity to really say, well, why am I pursuing nursing? So I started shadowing in hospice and doing community home visits, shadowing nurses. And really, I would say by the second time I applied, I realized who I was and what I could offer and bring to nursing. So I ended up transferring into the School of Nursing, and honestly, I've not looked back since, and that's led to other doors opening, which I'll talk about later.
Malcolm, if you could answer that same question.
Sure. Again, thanks for having me. I am a clinical psychologist by training. Right now, I'm working in a forensic setting. I'm the chief of psychology at the Superior Court of the District of Columbia, where I work with young people who have either committed offenses or had committed or offenses committed against them, providing therapy, individual treatment, group treatment, and also doing a number of evaluations for these young people that ultimately are sent to the court, and doing expert testimony and things of that nature. What into this? I probably at the beginning had very little interest in working in a court setting or in a forensic setting, but I've always had an interest in working with young men, and in particular young men of color. And, you know, I spent a lot of time in graduate school, obviously as a part of my dissertation, and even my own private work, really trying to think about ways to support young men of color who I know have such a difficult kind of space to negotiate within this country, right? And so I really spent a lot of my career dedicated to that. And we know, unfortunately, one place where we find a lot of African American men, far too many African American men, is in the courts and in the both juvenile and adult legal systems. So that's really one of the things that brought me into that space, just really feeling like this could be an important place for me to be able to make a difference. Another part of my work is a nonprofit that I have called Young Doctors DC. And that is really in part born out of, in some ways, the work that I do at the court. You know, you tend to work with young people who are really struggling and are at their most vulnerable. And what Young Docs does is allows me to work with another group of kids. And these are kids who are, for the most part, really high performing and have interest in becoming the next PhDs and the next MDs of the world and the next RNs. And, you know, all of these important health professions. And these are young people who we work with, who we mentor at Howard University, who want to go back into their communities and do this work, not only in the future, but right now. So, you know, I've been able to kind of, you know, work with young people in these two settings, both in non-traditional kinds of ways that still incorporate my health background.
Thank you. It's interesting to listen to all of you all talk. And I think this question is important because a lot of young people don't necessarily know what they want to do when they start off, or they think, you know, I'm going to do this particular thing. And then once they get out into the world, once they, you know, get into education or different settings, then their mind changes and they begin to explore different opportunities. So I think it's great to have you all be able to tell those types of stories to encourage young people to basically keep their minds open and thinking about the possibilities that they can have. I wonder if we could transition this into talking about your the training that took place for you all to get to where you are now, and thinking about, I know definitely the differences. Malcolm, you just talked about my alma mater, HU. And so, you know, thinking about the differences between, right. Thinking about the differences between the environments that HBCUs offer for training in these fields versus, you know, what we call PWIs in those institutions and what, so it'd be interesting to hear from you all kind of your experiences in you know, going to school, training for these professions, what any obstacles or challenges that you face because of the institutions that you attended. And so I guess Malcolm, I'll start with you just because we were just talking about Howard, so we'll jump in about that there.
Yeah, great. I did a lot of training at HBCUs. I did my undergraduate work at Tougaloo College in Mississippi, which is a small HBCU down, and you know, it was just very, very nurturing. You know, myself as kind of a budding scholar, I would like to think, and allowing me to see myself in that way, which I think was really important, and kind of not only allowing myself to see myself that way, but give the skill set as well, right? Tougaloo was a really small school, and excuse me, I liken it to a lot of people in my generation to Hillman, right? Hillman College, the fictional school from Different World. And I always remember in this scene where they're talking about Hillman, and I can't even remember who was making this point, but they said something like, you know, will because I've performed at Hillman, does that necessarily mean I'd be able to perform someplace else? And the president of Hillman says an A at Hillman is an A anywhere, right? And for me, that was really important. So just fast forward, as I contrasted to other experiences, I did a program at the University of North Carolina. And, you know, to me, coming from Tougaloo, right, we had one library and, you know, with however many books. And then I went over there and they had like 16, 18 libraries. And you know, I looked at that and I was like, how could you fail in this? You know, like we're doing this with one library, half a computer, and you know, pushing out, you know, really intelligent, strong people. And you know, you come here and you have all of these things at the tips of your fingers. And that, you know, being in that kind of space where you really had to push kind of for everything that you had, but you also had, you know, professors and peers who really supported you, you know, I think to me really gave me the confidence to be able to go on and do my work in other places. I did do my I ended up doing my doctoral degree at Howard, and afterward I did a postdoc at the University of California, Berkeley. So, you know, those were kind of my and I also spent a little bit of time. If someone from CUNY was watching this, they'd be like, "Why didn't you say us?" So, so the City University of New York also spent a little time doing some postdoc work there as well.
Tori or Charlette, if you could jump in on that question.
Yeah. So Dr. Woodland, my experience was very different. You warmed my heart as you just even reflected on your experiences. And so originally, honestly, I was considering going to Howard or North Carolina A&T. When I was in my senior year, I applied there to those two schools and UVA. And I was leaning towards going to an HBCU. And honestly, I had a best friend that went to Howard and a best friend that went to North Carolina A&T. And part of my respite and having moments when I could breathe was when I would leave the University of Virginia to go visit them for homecoming or just to hang out with them in their dorms or to do road trips. So some of my best friends would travel up there. The University of Virginia, one of the reasons that it interested me was I went for spring fling. That's sort of a time where Black students are invited to come. You get a chance to meet current students, other prospective students, and meet some of the faculty. And when I went spring of my senior year of high school, I met my roommate who ends up becoming my roommate, Elizabeth Samuel. She's from the Bronx, New York. We connected And Spring Fling was so intimate, I would never call the University of Virginia an HBCU. It is not. Thomas Jefferson established that university. We worked there. We were not allowed to study there. And the first Black nurse didn't come to UVA School of Nursing until 1968. And so it is by far not a historically Black university. And with that, I will say that what Spring Fling provided me, and it coincides with Black Alumni Weekend, was seeing that, oh my goodness, I didn't realize there was a legacy of Black student activism at the University of Virginia and a presence of Black students, but also the Black community within the Charlottesville-Albemarle area that plays such an important role of both protecting, nurturing, and pouring into the Black students that do come to the University of Virginia. So I ended up finding my pocket. And so some of that came from best friends that I met that were outside of the School of Nursing, some in the School of Nursing. And then I also pledged the sorority Delta Sigma Theta. And that provided me with camaraderie, friendship, and to be in spaces where I saw students that looked like me, and that protection that I think that I really did need. The School of Nursing in itself, once I transferred out of the College of Arts and Science into the School of Nursing, your class was about 90 students. And so as a Black student in that program, I would say 10% of our class were students of color in my graduating class. And you really couldn't hide being a class of about 90 nursing students and being, maybe one of 10 students of color in the class. But I did feel like in the School of Nursing, the faculty at least really respected what we brought to the student experience. As students, they recognized that we all had different experiences. We had a lot to offer, and there was a level of respect that was there. And so I think that had I not been in the School of Nursing and had those other entities and pockets, absolutely there would have been barriers. And I also had some calls home. There were moments where I had to call home and say, this is what's happening. This is what's going on, or these are my challenges. And having that affirmation from my mom sending me letters, letting me know she's praying for me. My dad would occasionally pop up and drive up and take me and my friends out. And so if I didn't have that, I think that what I've heard and from other friends that have graduated from the university is just that it was challenging and there were moments of feeling isolated. But fortunately, I was in a smaller pocket and had some layers of support. And what I would add to that is what I did notice is, you walk around grounds, we call it grounds, not campus, and you see there's such a rich history there. There's such a rich history of what took place in Virginia, what took place in our nation. But what I started to notice as a nursing student that I really noticed as a graduate student is, well, where are the Black nurses? Where are the Black doctors? And where are the Black contributors? Why are we not visible in the historic landscape here? And I think I'll go into that a little bit later, but to me, that is a barrier. What happens when you don't see people that look like you contributing to the sciences, contributing in humanities? And so I'm grateful for professors like Dr. Claudina Harold, who made history accessible to all of her students, and things like the Black bus stop. If you ever go to grounds, if you ask anyone that goes to the University of Virginia, they'll be like, oh, meet me at the BB. That was a Black bus stop. And historically, that was a bus stop where we would show up. We knew in between lunch, we're going to connect, find out what's happening during the weekend. And those kind of spaces and entities exist for reasons that we can talk about later. But that was my experience with the University of Virginia. I went back there as a PhD student, but I think that when I went back as a PhD student, I said, it's time to do something about the historic landscape here.
I have the polar opposite experience. I've gone to 3 PWIs. And as Tori mentioned, there aren't a lot of Black nurses, mentors, leaders, and there were none available to me. So when I decided I wanted to be a nurse, I left University of Maryland College Park and I matriculated into a very small conservative school outside of Knoxville, Tennessee. I was the only Black student, on that campus when I arrived. They thought because they didn't have very many Black students in general, excuse me, because they didn't have very many Black students in general, they often, assumed that I was on the basketball team or some sort of sports team. And so they would be surprised to find out a lot of times when they would ask me questions that I was in the nursing program. And again, I had to, it was a culture shock a bit. I grew up in Mississippi, but it was a bit of a culture shock because this was 2005. And I'm like, these students haven't met an intelligent Black person before in their life. And it was, I don't even know if I have the words for it. It's like I walked back into history. I'm glad that I was in that space because I was able to give a representation of a Black person that they had never experienced before. They asked a lot of questions that I thought that anybody else would be like, why are you answering those ignorant questions? But because I knew that a lot of them would end up in inner city areas working with Black patients, and they had never really met a Black person before, it was important for me to remove offense and just really listen to what they're saying so that I could lend them some advice on how to speak to other people that don't look like them, how to, that Black people aren't, ignorant, that we are intelligent. And it was just their context. They just had never really met any Black people that weren't sports players, which was, it was mind-boggling to me. So two of my programs, my master's program and my bachelor's program, I was the only Black student in my class. There were no Black faculty. It was lonely, if I'm honest. It was frustrating at times. When I would show up in my master's program for clinical, they would ask, and they do this on the nursing floor as well. Please excuse me. On the nursing floor as well, they ask, are you environmental services? Are you the CNA? It's frustrating. And I'm, and it's like, I have to take those moments, with stride and say, no, I am the nurse practitioner student here to learn from you today. And I had to swallow what I was feeling because I needed the learning opportunity, because I needed the clinical experience.
I mean, real life. We're in a pandemic. It's real life. I feel like it's no apology. Thank you for being real, Dr. Pace, because this is real life.
Yeah, exactly.
So my doctoral program, there still weren't any Black faculty, but there were Black students for the first time ever. However, this program is mostly online. So the first day of orientation, I'm looking around the room like, wow, here are the future leaders of nursing. I've never seen this many Black students in one place at a time, all here to, for a nursing degree, and let alone a terminal degree. So I don't know where those people are now because, again, most of the program was online. But like Tori mentioned, like you look at the landscape and you're like, okay, where are these leaders? I know they exist, but we don't see them contributing at the top. And so the whole reason why I went back is because I never saw anybody that looks like me. I'm like, where are the Black nurses? They say that there's 10% of the force that's Black, and every floor I worked on just about, I was the only Black nurse as well. So school prepared me for that and all of the challenges that come with, where is this Black girl come from? Who does she think she is with her degrees? And it was threatening to them. But I'm like, I'm just here to do the same thing that you're here to do. And that's to serve and to take care.
Indeed.
Thank you.
If I could jump in, it was just something I wanted to something to add on. that I heard Tori talk about. And I hope you don't mind if I call you Tori. Is that okay? I'm
Oh,
sorry.
yes, that's fine. Yeah.
Okay. um, right. And I also heard this kind of loop go through even, and it's something we talk to our young people about, and it's this idea of belonging, right? And when you're looking for a school, whether it be a PWI or an HBCU or even a predominantly Hispanic serving institution, right, what you want to look for is finding that space where you feel like you belong and receive that protection, right? So when you were talking about finding Delta Sigma Theta, and your first experience on the yard was spring fling, you were kind of and the black bus stop, you're already identifying these spaces, right, where it's almost like you have an HBCU inside of a PWI. And I just think that's a really important piece, and that's something that we help our kids to see. Like, it's not necessarily that you have to go to an HBCU, even though HBCUs kind of inherently try to provide that really nurturing kind of space. But you can find that space in other places. You just have to be creative and look for it. So I just thought that was a really important piece that I wanted to highlight. Thanks.
No, that's a very important part. And I think one of the other things that stood out to me in listening to you all speak, and this kind of segues into another question I wanted to pose to you all, is talking about mentorship. And so a lot of you were talking about faculty and looking at for faculty of color. And so I'm just wondering if you all could talk about, what role did mentorship, particularly mentorship of people of color, play in your training, whether it did or not, and then also how you see mentorship and your role as a mentor today, and how you pull that forward into what you do to train that and inspire that next generation. And especially for Malcolm, I think about the Young Doctors DC in that program, and then think about structured formal ways you mentor, but then also any other informal ways that you kind of mentor as well. So maybe if we could touch on that, maybe, and I'll start, since I mentioned you, Malcolm, if we could start with you, maybe talking about that.
I think one thing that I really like about doctoral programs are the ways that students are mentored in these programs, or what should happen. Sometimes I know that doesn't always happen, but typically you are coupled with an advisor, right? And that person supports you as you walk through your program, as helps you with your research. In fact, you might even be working on one of their research projects. And to me, that was something that was really important. I had a really terrific mentor and advisor at Howard. I had another terrific mentor and advisor at the University of California, and also a good one at the City University of New York. And these were people who really supported my research and continue to be a part of my life today. For me, I thought it was really important not to only kind of extend that mentoring, right, to graduate level students or doctoral level students, but for me, Young Docs was us extending that kind of experience to a small group of high school kids. Right? Why not have a small group of high school kids who are interested in health, interested in medicine, and work with them for 4 years in the same way that you may be supported in a doctoral program, where you're meeting with this person regularly, where they're going over your work, where they're really teaching you how to be a scholar. So part of our goal was to extend that same kind of relationship downward into the pipeline, because we know we need it, right? We know we don't have enough African American men, African American women, as you pointed out, in these positions. Luckily I'm in a space and have been for some time, where we really get to show our young docs, when we walk them over to Howard University and they're in the hospital, they think all doctors are Black. Right? They think all heads of surgery, all all heads of the university, they think that's how it is. And sometimes we have to remind them that once you leave Washington D.C., that's not always the case. But so part of us, what we wanted to do was really show people that example, which we thought was really important, and also bring that kind of mentoring to them. So I just think mentoring is huge. I think doctoral programs got it right. You set somebody up with a mentor. That individual really teaches you how to do this work. And I've been lucky to have that, very fortunate to have some wonderful mentors, and really something that I'm passionate about, making sure that I pay that forward.
I'll ask Charlette or Tori to jump in with that same question. But one thing I'll throw in there was when you were talking about this area, I think a lot of times for a lot of us, we kind of, if we aren't careful enough to think about it, we kind of forget that this area is kind of unique in many ways. And so we really have to think about how, you know, this Black majority that we have, maybe not so much in DC anymore, but definitely in Prince George's County, that, you know, that does not exist everywhere. And so making people aware, and definitely I think it's important because because of the institutions in the DC area that train people to go all over the nation, they need to be mindful of that, you know, they might not encounter this same type of environment if they go elsewhere. So I think that's an important point. Charlette or Tori, if you could jump in with talking about mentorship, the role it's had in your life, and then how you serve as a mentor.
Yes, thank you for sharing, Dr. Woodland, just about your experience. And I agree so much that mentors make all of the difference. And honestly, it goes back to what Dr. Pace shared in the beginning about her coming from a generational lineage of LPN. So I'm going to talk about two mentors I've had in my practice, then mentors I've had in my doctoral experience, because I'm currently a doctoral student at the University of Virginia, as I mentioned. So in my practical experience, when I was going through nursing school, I didn't have any Black faculty that taught me during my undergraduate experience, but I did still seek their office. So Dr. Kathy Campbell, her office was open. And so I didn't have her class, but you just naturally became familiar. Dr. Hinton, you just knew their doors were open. So those were spaces when I was a student. But once I graduated and I went into nursing, I started out as a cardiac nurse at a community health hospital. And it was the licensed practical nurses that took me under their wings. Currently, if you go to the hospital, you may not see, it's also like, where is the Black nurse, but it's also, where is the licensed practical nurse? And so historically, the licensed practical nurse has been present in the hospital space, in clinics, in our community. But what we have seen for a lot of hospitals, and especially teaching hospitals, has been a pushing licensed practical nurses into more community and clinical settings. So our patients don't necessarily get the benefit of seeing them. Our prospective nurses and our new grad nursing students also don't get the blessing of being mentored by these men and women who oftentimes have decades of experience, have been working in nursing for 20, 30, 40 years. And so my first mentor, her name was Jean. She was a Black woman. She's a licensed practical nurse. She could have ran the entire cardiac intermediate unit, run circles around all of us. I knew as a new grad, because there were 3 nurses that worked on this floor that were Black nurses. 2 of us were new grads, and then Jean was senior. The rest were white nurses. And so I knew, while I could ask my preceptor questions, there were some things that I realized, like, this is a question I need to ask someone I can trust, who's not going to judge me, who's a safe place to go if I see something of concern, but who could also teach you the things that you're not going to get from a book or an orientation. What is the history of this hospital? What is the landscape? How do you successfully navigate this space? She provided that for me. Jean is amazing. She perhaps has since retired, but I then transitioned from that experience. I ended up leaving the cardiac unit, realizing actually my passion is palliative care. I didn't know it at the time. I actually thought I was burnt out from nursing. I saw a lot of suffering. I saw a lot of interventions, but what I didn't see were goals of care conversation. What does this family member really want? What is of value to them? And why are we always pushing intervention and surgery before we're actually asking them what the goal is here? And so I started becoming familiar with the palliative care service. Someone introduced me to VCU, Virginia Commonwealth University's health system, which is a teaching hospital, and they had a palliative care unit that was established about a decade. And so I ended up going there, and guess who was there? A Black licensed practical nurse. Her name was Joyce. And so it was a smaller unit. I loved working there. She and I were the I believe at the time, the only Black nurses that worked on our unit in particular. The difference there was that I loved coming to VCU Medical Center because I also got to take care of patients that also looked like me. Where I was before was probably more of a rural-based community hospital. And I'm sure there were moments where I walked into patients' rooms and they were also like, and she's taking care of me today. And it's like sort of that show and tell, show and prove. But by the end of the day, they're like, are you back tomorrow? Because you're like, we take our care seriously. But when I went to VCU, what I love is it's an urban campus, it's in the city. I got to take care of patients that look like me, but I also got to see more nurses, doctors, chaplains that also looked like me. And so that was a huge value add. But Joyce was a licensed practical nurse. And prior to her leaving the inpatient hospital setting, she provided great mentorship, and so did the nurses on that floor. Fast forward, if I would talk about my doctoral program, my advisors, my direct advisor is a white woman, but fortunately I would call her an ally. But I've learned to seek mentorship additionally, like always outside of who I'm assigned with or who I just believe in having multiple mentors. I think it's really important. You almost need to build a team around you. That's the advice I would give to anyone starting a doctoral program. It's that, you need an advisor and you need a good mentor, but it is important to build a team around you. And so I've been fortunate that I've seen more visibility of Black faculty coming back to the doctoral program, Dr. Eshawn Williams, Kathy Campbell, who's still there. But I've also sought professors outside of the School of Nursing. Sometimes you have to leave your area of study and also seek mentors outside of that space. And I have in the history department, Dr. Talitha LaFloria, Dr. Claudina Harrell, Dr. Derek Alridge, just people that have taught me things that I realized I needed to learn. And I do encourage all students, whether you're going to medical school, if you're going to nursing school, I do think it's important. It's like the humanities is so important. And you may not always have time to take those classes, sit in their office hours, still seek those opportunities to learn and engage with those outside of your direct field, because there's such great value in sitting in that wisdom, sitting in that knowledge, and building bridges outside of your own profession. So I would say that mentorship has looked different for me. It's shifted. And I'm grateful to have both faculty who are Black men and women that I've identified as mentors, but then also some faculty, since I'm at a historically white university, that there are faculty there that are allies, that I would say are true allies, not just saying they're allies, that have made this journey helpful. And in terms of mentorship for me, we do like peer mentoring. So as soon as I see there are new students coming in, my door is open, my phone line's open. And especially if they're students of color, I personally reach out to them. In terms of those who are younger, I'm a part of our emergency response team at my church. And so I think it's important for our community to see us in these roles too. And so I'm involved in that capacity. And then for me, I use nursing history as a way to, now I wouldn't even just say mentor, but to collaborate with those younger and older to really ask the questions of what is our history and what story do we want to tell together? And so for me, mentoring looks multifaceted, and I would say I'm grateful for those who have invested in my journey. Lord knows I would not be here without it. I probably would have quit or stopped six or 7 years ago. So I love hearing about what you're doing, Dr. Woodland, and just hearing about the mentorship. That's amazing. And I wish that we had something like that in Richmond.
Charlette?
I guess a lot of what Tori said resonated with me because it's a very similar experience that, mentorship is multifaceted. So I spoke on being at PWIs and having to find allies because there wasn't anybody that looked like me. And then sometimes I looked outside as well. So I found Black nurses in the cities where I lived. I actually worked at Hopkins. Well, I actually do work at Hopkins as an adjunct, but I also worked part-time. Yeah, I worked part-time at BCCC, only because I found out that there was like pretty much all Black nursing faculty there. And so it wasn't that, you know, I was like, oh, I want to work at BCCC. I wanted to be around like doctorally prepared nurses that were leaders, that were teaching our next generation. And it was just super inspiring for me. And so it inspired me to always kind of sort of keep like a little adjunct position to the side, because I didn't want there to be a nurse in a situation like me where you didn't have anybody that looks like you. And so I keep this adjunct position at Hopkins, which is a great institution, but they have just a handful of Black students. I make sure, I make it my business to reach back and reach out. Water, whatever you need, you know, whatever you want to experience. I mean, whatever you want to talk about, I've probably experienced it already. And if I can try to make that journey a little bit easier for you, I'm happy to do that. Like, I am an open book. Like, I will tell them, like, listen, you're going to probably be discriminated upon. When you get to your position, you know, that Black tax, I talk about that. Like, we shouldn't even have to talk about those things at this point. But I'm like, you have to know your stuff. And if I can help you do that, I'm happy to do that. But that means that you're going to have to do some work outside of your shift. So that's been my experience. So I always reach back. People know in my community, I'm very, in my circle, I'm very open about my journey, about being a mom, having two babies in both programs. So lots of different people reach out to me about like, how did you do it? Like, I don't even want to do the program and I don't even have children. I'm like, anything is possible. You can do it, but they need to see Black people doing that, balancing, you know, what seems impossible. And I tell people, I cried, I was upset, but I'm going to reach back every single time because, you know, I didn't always have that. I kind of had to reach out for that, but I definitely reach back now. So I have high schoolers, college students that I talk to all the time and mentor for free. You know, a lot of people do the programs for money, but I do it for free because sometimes the value that you add, it's like priceless. So I'm like, I can't put a price on that. It only, if it's 1 hour that you're like, you just need to get out, 1 hour of talking to someone will make a difference of them not quitting a unit, I'll do it.
Thank you. So I guess I wanted to take the conversation into looking at the past year or so and looking at COVID-19, of course, this pandemic that we didn't expect, and we didn't expect it to last this long. And it's you know, wrought so many changes in our society. You know, why we're having this, you know, online panel discussion rather than sitting down face to face. But if you all could maybe address this past year and how COVID-19, the pandemic, has affected your work. And maybe Charlette, if you want to.
The first couple of weeks of the pandemic, you know, every service was able to go, you know, they were like, we'll never do telemedicine. Everybody somehow transitioned to telemedicine except for cardiac surgery. People still have to have cardiac surgery. So I was still, you know, getting occupational exposures at work. When people were saying, you know, children aren't being affected by COVID-19, they were, because I got exposed several times. And so we had to learn how to navigate around all of that. And then the other thing that has kind of just been recent for me is me deciding to get the vaccine. I have been super transparent about my journey because a lot of people have questions. They don't know who to ask. They don't know, they have a lot of fears. I actually did it scared myself, if I'm honest. I was, you know, I had a lot of questions that weren't able to be answered because this is happening like right now in real time. And so I did it for our community, not just for me and my children and the patients that I take care of and trying to keep them protected, but I also did it because there are a lot of people in our community that just had a lot of misinformation. They were, you know, spreading information on, you know, our feeds that, you know, implanting chips in it, all kinds of just craziness. And so I kind of vlogged my process, told them what my symptoms were, all the way up to like 36 hours later. I got my other vaccine today. I let them know like what was going on with that and what kind of symptoms I have. So COVID-19 has been like still busy. People have lots of questions, and there's a lot of information that they want to know that we just might not know, just because this is still, happening and evolving, and we hadn't had great leadership. But I think that for the most part, we've definitely learned the word pivot, and we've definitely had to pivot in a lot of areas and just be creative with our patient populations and just keeping ourselves safe and sane.
Definitely that. Malcolm or Tori? I guess maybe Tori.
Go ahead, Tori.
Sure. Dr. Pace, one, I just want to say the fact that you are a pediatric nurse practitioner, also a mom of two, and teaching, hats go off to you. You are wearing multiple hats and working all the more during this pandemic. I'm so grateful our patients get to see you, especially during surgeries, and just hearing the fact that you've also vlogged this experience. I just commend your bravery, and also acknowledging, like, I also got the vaccine scared. Similarly, I also got the vaccine scared. It was a process for me. I'm a woman in my 30s. I have childbearing years. There's just information that we don't know. But ethically, I felt a responsibility, because how can I administer this vaccine in the clinical setting? And I've not received it myself. I don't know what symptoms to tell my patients to look out for. And I just wanted to go through the process myself. So I empathize with our community, and I recognize that some of the fears and misinformation also come historically from unaddressed racism, and racism that continues to perpetuate within our healthcare systems, our legal systems, our nation. And I think if 2020, you keep hearing the tagline, like, we've got two pandemics, we've got COVID-19 and racism, but if we were really to be honest, racism's been going on for so long. And so I do understand where the community's concern is. And the onus really is on the health system to address racism within our health system, within our research. And that gets at, like, is the health system trustworthy? And so I think that is why we are also in these places, in these roles, and in these spaces, because we want to be able to advocate for our community, advocate for our patients, and we also ultimately want to do good care. So for me, I work clinically as a palliative care nurse. And for those who are unfamiliar with palliative care, a lot of times people hear palliative care and they automatically associate it with hospice or end of life care. And it's not that palliative care is not that. It just means that at point of diagnosis, if you have what is deemed as an uncurable illness, you may be well suited for palliative care. We focus on goals of care. So sometimes it's those difficult conversations that talks about, what would you want if you were in a scenario in which your condition worsened, or there was no cure, or there was, you were in an ICU and you were on a ventilator for X amount of time. But also, what are your values, and are we applying them in your care regimen? So we're connected, our department's connected with Massey Cancer Center. So a lot of my patients have a history of cancer, but I also see patients that have congestive heart failure, who have been sudden accidents. And with the pandemic change, we have end of life patients who are dying because of COVID-19. And so as I've heard, as I hear people say, oh, it's not that bad, the media is making it out to be something that's terrible, I'm like, what we're seeing at the bedside is that this is affecting people's lives. And it's not just that we have patients that are dying, it's also that families are having a hard time having closure. Our unit used to be vibrant and lively. We would have visitors, families. On our unit, there was no set number of visitation, because we recognize at the end of life, you could be a grandmother with 10 kids, and all 10 deserve to be at the bedside if you would like that. But in the pandemic, we've had to restrict those numbers. And there have been moments where the health systems had to say, for health of the employees and the patients and the visitors, they've had to restrict visitation. And honestly, ethically, that's pulled at my heart, because there are moments when you're having to make the call of who can be present at the bedside at end of life and who cannot. And so that, I will say, is a big difference. We also rely heavily on our families to advocate for their patients, our patients. A lot of the patients that I care for, some of them aren't able to communicate for themselves because of the state they're in. So I rely heavily on the families to tell me, what was your loved one like? My love of oral histories, and that tradition didn't start in my doctoral program. It started at the bedside, hearing stories about patients, taking care of World War II veterans, survivors of the Holocaust, members of my own community. And so for me, what I'm really seeing is that COVID has shifted in which families aren't as present at the bedside because they can't be, not that they don't want to be, but it means as a nurse, my role is to be those families' eyes and ears and their advocate. And so you're trying to do that while wearing your protective gear, while trying to provide good care. There is a nursing shortage right now. And so a lot of health systems were also running short staff. There have been healthcare personnel who have tested positive for COVID, and so they're also out. I'm in the doctoral program, and I'll just be transparent. Throughout the program, I've been living with my parents. And so they won't like me telling you their age. They're older and old enough that, I come home and I'm trying to also make sure that I'm not exposing them to anything. So it's been different. I will say one thing I'm grateful for is on my unit is teamwork. If there wasn't teamwork, but also shared governance and us advocating for what we feel like we need, I think this would be a very hard stretch. And sometimes your 12-hour shifts become 14-hour shifts. And sometimes you leave and you're like, I did the best I could. And you're hoping that was also good enough. And so my heart goes out to everyone, but not just the nurses. It's also the secretaries who are answering the phones and helping our families get back. It's those working in environmental services, as you all mentioned also, that are coming in and making sure the environment is safe. It's those working in transport services. It's those who are helping us get our patients to the morgue also sometimes. And just the health system, while nurses and doctors are front center, I just have to acknowledge also those who have been making it possible for us to work. So it's definitely a difference. And I feel for our new doctors and nurses who are also coming in and trying to learn in this environment. It's challenging, but we need them as well.
Thank you. One thing that just listening to you, a lot of things stood out, but one thing that stood out for me was when you were talking about, your role, especially being important during this time and being the eyes and ears for the patients, and makes you think about how important that is for there to be people of color who are being the eyes and ears for patients because of this, not necessarily intentional prejudice or bias that people might have, but it's there. And so how that, affects how people are treated in other parts of our healthcare system is important. Malcolm, if you could jump in and talk about how COVID-19 has affected your work in the field.
Sure. So in terms of my psychology work, just like everyone else, we really had to pivot very quickly to telehealth, to teletherapy, to really being able to figure out how to engage young people virtually. Interestingly enough, I think that was more of a strain on the professional staff, to be quite honest, in some ways than it was on the kids, because kids have been engaging virtually for much longer than we have. So, once we pivoted, we found that the kids were really able to invest in ways that, have been instructional for us moving forward, right? About how to continue to engage our young people in what we would consider innovative ways that they would consider probably something that they just do, right? Kind of walking down the street, talking, on the phone, right? We see kids doing that all the time. Usually they're not talking to their therapist, but now, right, they may indeed be talking to their therapist, because I know some of my therapists have had that experience where the kid is in the back of the Uber, like, all right, let's do this therapy now, doc. So I think that's been one piece. But on the other side, young docs, what's been interesting is I think it's really kind of pushed my resolve in that area. I think with Young Docs, we were always very focused on health disparities in our community and talking a lot to the Young Docs um, about diabetes, about heart hypertension, and really focusing on those issues and how they're kind of these systematic things that have placed communities of color in these positions where oftentimes we're not well, right? We're just not well, certainly in the ways that we would want to be. And I think COVID obviously shined a huge light on that. And I think that was something that the Young Docs were able to see very clearly. And the other piece of Young Docs was not only focusing on these health disparities, but really developing a group of people in communities who are trusted ambassadors, right? Because I think we all can agree that, it's one thing when I say something, right, to one of my patients, or even when you say something as a nurse, but it comes off completely different when it's their own child, right? When, it's your next door neighbor who, you've seen riding his bike up and down the street for so long, and now he's wearing a white jacket and talking to you about health and well-being, right? And we thought that was something that was important. So right now, what we're talking about a lot is vaccine hesitancy, right? And really using the Young Docs to kind of go out in their community. So right now, they are collecting data actually at this very moment. So they've polled at last check 1,700 people and looking at what their responses are, whether or not they plan to take the vaccine. If they're not going to get the vaccine, why not? If they are, why are you considering it? And the goal has not only been to ask these people questions, but also to kind of engage them, right? And if they say they're not going to get the vaccine, try and dispel some of that misinformation that may indeed be out there, because we recognize that everybody has a choice, right? Whether or not they're going to do it, but we don't want that choice to be based on misinformation. So part of what we've really tried to do with our Young Docs, and again, it's just really strengthened my resolve to move forward with this program, because I think it's so important to have young people who are in their community, who are already trusted in their community, who people already know, who are, equipped with facts, right? And can reach out to healthcare professionals when they get over their head and say, oh, okay, well, let me call this person who can help me out. And, we can really, connect our communities in those kinds of ways. So for me, it's allowed me to, one, pivot in some ways, to I think what would be more innovative approaches, not only in, my clinical care of patients, but also it's really kind of strengthened my resolve for, the importance of this work, and having, and training a group of young people who are committed to doing this work in their communities.
I think one of the last things you said that kind of segues into the next thing that I wanted to ask, and you talked about innovation. And so thinking about, I wonder if you all thought about the ways in which the pandemic, the situation that it has created, what are some things that are positive that might come out of this? So there's a lot of discussion now about, that health disparities, like you said, that have existed for decades, but now is becoming more and more known about the health disparities and how they affect the people of color. And so, is this a opportunity? Is this a window now that the pandemic is going to open up some opportunities for these, structural elements in our society to be addressed? So just kind of generally, what do you all think about what are some positive outcomes that might come from this pandemic? What are some opportunities that we have right now in front of us to push the ball forward as it relates to Black healthcare?
Yeah, well, for me, hopefully it will, continue to shed light on that important discussion about health disparities. For us as an organization, it's really, forced us to think about how to engage people virtually, right? I think when we were talking earlier, I talked about, doctoral programs and how I think they really got it right in terms of focusing on a small group of people and, really giving them the skills to succeed. What we've seen or what the pandemic has forced us to do is engage virtually. So something that was really interesting that we were able to do over this summer was we said, well, hey, since we can't do our summer academy on Howard's campus, since we can't bring the kids in, why not do it virtually? And since we're going to do it virtually, why not open it up to anybody, right? Anybody who has an internet connection, let's give them the experience of being a young doc. And what happened was amazing. We ended up having kids from all around the country. We had kids from California. We had kids from Detroit. We had kids from Texas. We've had kids from Puerto Rico, right? Participating in our program. And it was funny because we didn't think about it. We just said, hey, let's open it up. But we didn't think about changing the times, right? That we did our programming. So we start our program at 9 a.m. What did that mean for the West Coast kids? That they're on at 6 a.m. But again, that was amazing as well to find, young people so interested in doing this work, so interested in being healthcare professionals, that they were willing to be up at a call at 6 a.m. talking about, health and wellness in their communities. And these are high schoolers. So again, for me, while there are a number of aspects of the pandemic that obviously that I really struggle with, and in terms of losing, colleagues, losing family, and all the loss that's been going on in this world, there are some things that have really been a silver lining. And I think for me, just really strengthening that resolve for the work that we're doing with young doctors has been one of them.
Yeah, that's great. 6 a.m. for a high school student, that definitely is an achievement.
And I told him, I don't know if I would have woken up at 6 a.m. in high school to do this. So I was so impressed by them.
I guess, Tori?
One positive thing that I have seen is the desire to blend more humanities. Even though you saw at the beginning for a lot of our institutions, they're like, we're only going to be teaching our required courses. And there was a decrease in the electives and the humanity courses that were being offered. It was the pandemic, everyone's going remote. But then I feel like after that, the students and faculty were really pushing, we need our humanities courses. And for me, what I've seen is an emergence of history in a lot of our health sciences. And so where sometimes in health sciences, it's been seen more as an elective, a lot of schools of nursing in particular, I know at least at our School of Nursing, we've been asking the question of foundationally, what do our students need to know as they enter and before they leave? And it's not enough to know how to check someone's blood pressure. We need to be more introspective. We need to look at our institutional histories and how that impacts how the community and patients engage with the health system. We need to look at our research. Are we asking the right questions? And if we haven't in the past, are we owning it? And what conversations do we want to be having? And so what I've been seeing is a desire to bring history and the humanities to health sciences, which in my opinion is just one of many routes and ways I think we need to use to address racism, historic racism and present racism. And so I've been excited to see that there have been platforms to talk about institutional histories, how that impacts care, how that impacts the community. And for me, it's been an opportunity. Initially, I remember when I pursued nursing history as my dissertation focus, there were some questions about it. Maybe that's something to do as a passion project, but not necessarily as a dissertation focus. But now what I'm hearing is, oh, I'm so glad that you chose that. Now I understand why that's significant now. And so, coming up on 6 years later, there's a connection to the work that looks different. And so I'm hopeful that for some of the institutions that have a history that needs to be reckoned with, that there will be some acknowledgement. There will also be different preparation as we're onboarding new staff and health personnel. I'm also seeing an increased call that's saying like, it's not okay that we don't have enough nurses or doctors of color in these spaces. What's happening here? And so I'm hoping it will ripple down to an investment early on, just like the Young Docs of DC program, which is saying, well, let's start earlier. Why are we waiting until students get to college? We need to make college even accessible. And so I'm hopeful that college, hopefully costs will be more accessible as they're adjusting things. Also that we're paying attention to how we're recruiting our healthcare professionals. But the last part of recruiting is also how we're retaining them. And what I do hope is that we're able to retain them. Dr. Woodland, you talked about like the health and well-being. That's going to be an important piece. And I do see more wellness talk and conversations about self-care that I don't think you always saw. And so it's one thing to preach that for our patients. What does it mean to adopt that as a healthcare professional so you can have longevity in this profession? And then opportunities like this. I mean, I haven't met you all in person, but I feel connected to you all now. And so I'm grateful to see how different programs are flipping and making their spaces more accessible through a digital media and digital platform. So that's been exciting to see. And also, sometimes you need to be moved still. I think what this pandemic did for me is it required the hard pivot that you all are talking about, but also a grounding to really ask what's important and what am I going to do with my time.
Thank you. I think we are about out of time, so I'm going to just close it up by just thanking you all for, there's so much more that we could discuss. We could be on here for forever because this is such an important subject, but I'm glad that we're able to come together. Like you said, that this is bringing us all together, and hopefully that we can continue to, you know, collaborate in different ways. And this has been just an important, very important discussion. I thank you all. So we have Ms. Tori Tucker, Dr. Malcolm Woodland, and Dr. Charlette Pace. Thank you all for joining me to talk about Black healthcare, and hopefully we'll talk again soon. So thank you.
Thank you.
Yes, thank you. Nice meeting you all.
Nice meeting you all as well.
Y'all as well.
It's a pleasure.